I was going to use this episode to talk about one of a number of initiatives we can take to drive down the cost of healthcare. That's an insurance exchange. That's where a person or a family can go to one place and choose from a bunch of different options, coverage plans that meet their needs. Instead, I got hung up on a concept called the individual mandate. Of course, it's a misnomer. It's not an individual mandate. It's a government mandate on the individual requiring every person to have health care coverage. The mandate is seen as key to universal health care because it addresses the issue of adverse selection. Adverse selection is where healthy people don't buy insurance. Not necessarily because they can't afford it, they just don't see it as a good value. Unlike a sick person who sees it as a good value because a lot of the medical procedures they use are covered. But with the use of all those medical procedures, the cost goes up. The cost of insurance gets even higher. I don't support mandates because I think to work they have to be paired with subsidies. And I think subsidies create unsustainable costs for society. It's something a writer on Reason.com website termed mandate creep. And how that starts off is you have lobbying groups for a disease or a syndrome or a condition or maybe a medical specialty. And they pay their legislator, lobby their legislator to get that coverage for those particular diseases or conditions mandated. With legislatively mandated benefits, the costs of insurance go up. Well, what does the consumer do now? Drop the coverage? No, that would be illegal. So the consumer is stuck with either rising costs, higher premiums, or more subsidies from the government/taxpayer. Now, many people in this country think that universal health care is the way to go, and they have no problem with the mandate, and they have no problem with the additional tax. This would be enforced by the IRS. That alone is reason to oppose this. But many people want to emulate the European model of social welfare. But that model comes at a cost of some of your freedom. And before you are willing to give up more of your freedom in the name of the common good, think about this. Did America rise to its current level of prosperity and economic and military power because of our entitlement programs, because of Congress, because of bureaucrats, or because of our singular devotion to liberty? Is France the shining city on the hill? Was Emma Lazarus writing about Sweden or Italy or Luxembourg when she said, "Keep ancient lands your storied pomp. Give me your tired, your poor, your huddled masses yearning to breathe free"? No. If you want to continue the American experiment, no on the mandates. If you want universal health care, get on a plane. I hear Cuba's nice.